All right, it looks like we have enough attendees to join now. Thank you everyone for joining today. Um, this is a webinar on the CRIS Reporting Services pre-post report. We're very excited to share with you a redesigned version of this report and just go through the new features and just kind of a refresher too of the pre-post report in general. So let's get started. Just some housekeeping items. We're recording this webinar, and then also we'll distribute the slide deck and the webinar after this presentation or after the webinar to all the attendees that are attending today. We muted all the audio lines to avoid distractions during the presentation. And if you have any questions throughout the webinar, please use the chat box. We'll get to questions either at the end if we have time, or we can always stop in the middle if there's a couple of questions that we need to answer. So please use that chat box feature for any questions. We'd be glad to answer. And if we don't get to them today, we'll always reach out to you. All right. So our agenda today, just providing some background on the pre-post report itself and a high-level overview. We'll just go over the data that is in the report and then accessing the report, uploading a pre-post program, and then some new features, and then we'll have questions. So for some background, the pre-post report compares hospital utilization before and after a patient's program enrollment date. The hospital utilization data stems from the HSCRC case mix data, which we'll get to in the next slide. The basis report is just to show you and see and kind of understand how your program's doing and looking at hospital utilization before and after that program enrollment date. And so we know this report is very useful. There's a lot of super users, a lot of people use this report. And so we've collected feedback over the years. Um, and so basically we redesigned this report based on that user feedback and working with users and seeing what they need and what they want. We know the original report runs a little bit slower, it's a little bit clunkier. Hopefully now this new report is faster, it meets the needs of users, and we're always looking for feedback too. So this new report includes new tabs and some additional features. We have more reports in here. There's detailed patient demographic breakdowns. We have some additional filters added. And then we incorporated some other measures such as readmissions and PQIs, which in this report too. So as I mentioned, pre-post uses the HSCRC case mix data. For some background, the HSCRC case mix data is an all-payer claims-based data set for any page or for any visit that occurred on a hospital campus. So basically, this is for any hospital in Maryland. Basically, this report or the HSCRC case mix data, um, we use this for the hospital utilization data to look at visits pre and post that program enrollment date. So the visit again has to occur at a Maryland hospital on a hospital campus. For example, if I go to Johns Hopkins Hospital, this visit will be in the case mix data. If I go to Johns Hopkins Community Physicians, this visit will not be in the case mix data. We put um, a link at the bottom there. If you are not really familiar with the case mix data, you can always look at that after this webinar. One thing about the case mix data too, there's about a 2-month data lag for when we receive it, so always keep that in mind. We just refreshed the case mix data through June 30th. So right now the data is through June in the CRS portal. And so one question might come up is how do you use the case mix data and link it to my patients? Well, basically, CRISP assigns a unique identifier to the patients that are uploaded in a program based on the different upload methods. We'll go through that later today. And then we link the patients to the case mix data, and then we're able to pull the utilization data for the patients before and after that program enrollment date. And so before we jump in, going through the report and uploading a program and all those details. We just wanted to go through high level of accessing the report. So basically, you can access the pre-post report by logging into the HIE portal. So portal.chrispelt.org. Um, and um, from here, you will log into your HIE portal account, and then log into it, and then you'll click the reports tile, which I'll show in the next slide, in HIE portal, and launch the CS portal. If you do not have access to HIE portal or the reports tile, please contact your HIE admin or support at chrispelt.org, and they'll be able to help you out. So like I mentioned, you log into HIE portal. This is the homepage of HIE portal. You'll select the reports tile there, pointed in the red, pointed to in the red, and this will launch the CRS portal here. And so you'll find the pre-post redesign report within this all payer population tile. One thing I like to highlight on the CRS homepage is this favorite section on the side here. You're able to click on a heart next to the report and it will appear in your favorite box on your homepage. Just if you're going to this report frequently or any reports frequently, you can always favorite reports. And so once you click that all payer population tile, you would select pre-post, and then here are the two reports. You would click on this bar icon here, and this will launch the report for you. One thing to note is next to this bar icon, there will be a question mark icon, and this will be the user guide. The user guide will be added on August 22nd. We will be sending it out today with the slides, so you have the user guide. We also sent it out in previous communications for this report, so you should be able to have access to it, but just for ease of access, we're going to be adding it to the portal. And so now I want to jump in to uploading a program. So basically, to use pre-post, you have to upload a program. And we require users to upload a program because we need this program enrollment date to be able to look at hospital utilization before and after that program enrollment date. And so in order to upload a program, you can go to two places, and we'll walk through all the steps of uploading a program. In the all payer population tile, which where pre-post lives, there's this case mix program loader, and you can click on it. And then on the right side of the screen, you'll see this pop out, and this populate here. And you will need to name your program, select your MRN type, if it's a hospital or a panel, which we'll go through in a second, and upload a file. You can also, this exact case mix program loader appears if you click the new program button in pre-post and path. Any programs you create, you'll be able to see in pre-post and path. One thing to note, path is our patient total hospitalization report. It does not account for program enrollment date, but we need program enrollment date for pre-post. So those are two ways you can access this case mix program loader. One is in this all payer population tile, and then two with this new program button in pre-post and path. So to upload a program, I kind of went over or kind of said some of this high level. Here is a screenshot of the case mix program loader, which we just saw on the previous slide, but a little bit closer up. First, you're gonna so if you want to set up a new program, you're gonna select that new program bubble. Program name, you're gonna name it whatever you want. It does not matter. You can include a date, you can include whatever your program's name is, whatever helps you to identify this program and if you need or when you look at it and look it up. And then you need to select the source MRN type. There's two different ways to upload a program, which we'll go through a little bit in a minute, but basically the source MRN type, you're either gonna select hospital MRN or send panel. Basically, your source MRN type depends on how you are uploading this panel and what source or program and what source you're using. So if you select the hospital MRN option, this is your hospital user, and you're using your HSCRC case mix MRN. If you select Send Panel, you are using your Send Panel and using the MRN on your Send Panel and your source code on your Send Panel. We'll go through that in a second. It can be a little confusing, but basically, if you're a hospital user, you have the option of using your case mix MRN if you do not have a panel set up with CRISP. And then from there, you will either select your respective panel that you're for the program you're uploading or hospital. Then you will download this template, and down here at the bottom, it says is a screenshot of the template, and you will fill in the MRN, source code, and program enrollment date. We'll go through these in a minute, what each one means, and then you would check off the attestation box and hit save. And so here, this is how you create a new program. You're also able to update programs that you've already uploaded. Steps are similar, and it will prompt you to go through, but we're just going to go through uploading a new program today. So as I mentioned, there's two ways to upload a program. Either your hospital MRM based on case mix, so if you're a hospital user, you're able to go this route, or a panel, so a send panel, that you uploaded in panel processor, however you're uploading your panels with CRISP. And so basically the different fields here are listed at the top in that template. So for MRN, if you're using the hospital source, if you're uploading via the hospital MRN route, you need to use that MRN that's in case mix. That is just so we can match it to the data and so we know you have a patient treatment relationship with the patient. If you're using a panel to upload your program, use the MRN on your panel. And so the format for this both are the same. It's a text, and I just put an example here of what an MRN could look like. The source code, so for hospitals, you have to use the CRISP source code for the hospital. If you don't know what your hospital source code is for CRISP, you can just find it in the user guide. It should be at the bottom. For panels, CRISP assigns a source code to the panel when you upload it, just as an identifier. And it's pretty easy actually to find in pre-post because when you select your panel in the drop down, right here it says hospital bill, say panel. In the drop down in the case mix program loader, it will be in parentheses. Both are text and then an example here at the bottom. So if you're a panel user, you'll see your source code in parentheses in case mix program loader. And it should look like something all capital, such as CRS underscore test. And then program enrollment date, it's the same for both ways for uploading a program. You just need to put in a date of an appropriate date. And the format is listed here. So just month, day, year, and then an example. For uploading a program, one of the enhancements for pre-post redesign is users can now upload multiple source codes into a program. Before, with the old pre-post, you only could use one source code in a program. Now you can use more than one in a program. And so at the bottom here, I just wanted to include an example of what this template looks like, one, filled out, and two, if you want to use more than one source code. So here in this example, I have CRISP as a source code and CRISP Health as a source code. MRN 12345 is associated with my CRISP panel, say. MRN, the other two MRNs, 5, 6, 7, 8, 9, and then 90123 is associated with my CRISP Health MRN, a source code. And so here I put in the program enrollment dates and I'm able to upload this into pre-post. And so when you create programs, anyone with the same access as you is able to view these programs. So if I upload this program and I had a colleague who needed to view the program in CRS, they would need access to CRISP and the CRISP underscore health source codes in CRS in order to view the program. So that is just one caveat we want to mention. So whatever source codes are in the program, the person will need access to in CRS. Um, and going forward, now that we release this redesign report, we ask that anyone who is uploading new programs, please use the redesign report. Honestly, it's easier to use, but it's just streamlining it and making sure everything's working accurately. And it's just one of the things we're asking right now because we plan to retire the old pre-post report, which we'll get to at the end, a specific date. And we want everyone to be using this redesigned version. And so when you're uploading a program, we mentioned the format and the source codes and a lot of things. And so sometimes you'll get program errors. And basically with this program error, you'll receive this prompt here will pop out when you're uploading the program. It will tell you why the records weren't uploaded at a high level. And you're able to partially upload the program. If it's only like one or two patients and you uploaded like 100, you can just go ahead partially upload it. Not sure what's going on with one or two patients, but if it's like half your program or over half, you might want to download the invalid patient list to see why those MRNs weren't uploaded for your program. And so basically, here's the program error list that you will receive when you download when you download the error list. And so error types 1 through 6 on the side here. Um, the patient will not appear in your program at all. But for error type 7 and 8, your patient will appear in the denominator still of your pre-post program. And so some of the reject reasons might be a missing MRN. So you're uploading a program real quick and you just accidentally miss an MRN with one of the source codes. Missing a source code. Um, you can't upload the same patient twice in the same program. They need to each be unique patients. There is a source code mismatch. So the panels you selected in the program case mix program loader are not the same as what's in the program. So that's a pretty easy fix. And valid enrollment date. So you need to have, so you need to make sure it's formatted correctly. The enrollment date cannot be before October 1st. Technically, it really can't be before November 1st, 2015, because we need enough case mix data run out, which we'll get to be included in pre-post. Just so we have data for 1 month before that program enrollment date, which we'll get to in a second. And so these 1 through 6, they will not appear in the report at all. But if you use, but error 7 and 8, members EID not found in Christages, it just means that we could not find a unique identifier for that MRN and source code to match with case mix. Something might have happened during upload. This one's like kind of hard to figure out, but it shouldn't really happen often. And then members not found in case mix data after this October 1st, 2015. This should only happen with hospital users when they're uploading with the hospital MRN, just because we need to make sure that patient visited your hospital and we could not find that MRN within your hospital, so we really can't pull anything. Um, Next slide. So now that I've talked a lot about uploading a program, pre-post, where it's located, I mentioned a little bit about the pre-post redesign. We'll start going through some of the features in the new report. So the previous report, you are all here, so I assume that you have experience with the pre-post reports, but in the previous reports, you can see here, the top, we have the different tabs. The redesign here, the new tabs, the new reports, which we'll go through today. Any measures and metrics that were in the old pre-post report, we made sure to transfer over to this new redesigned pre-post report. If you have something that you're trying to pull and you're not sure like how to pull it out of this report, always feel free to reach out to us. There's an email at the end of this webinar. If there's something in old pre-post that we overlooked and that you need in the redesigned version, again, reach out to us. We want to make this report as usable and helpful to use as we can. And so the next couple of slides, I'm just going to give a high level overview of the report and different measure or in the different methodology, or not different, but the methodology, new features, and the reports. So for the methodology, taking a step back before we show all the features, we must have enough case mix data run out from a program enrollment date in order to be included in pre-post. So for 1 month pre-post, a patient's enrollment date must be a minimum of 1 month prior to the most recent case mix data. This can get a little confusing because there's a 2 month data lag in the case mix data. But as I mentioned today, our case mix data is through June 30th, 2025. So the patient will need at least a program enrollment date of May 30th, 2025. We need that 1 month post of case mix data in order for the person to be included in the analysis because we don't want to skew results. And so this patient would be included in 1 month pre-post. If you want the patient included in 6 month pre-post, you would have to do 6 months prior to the most recent case mix program enrollment date or case mix upload date in order to be included in the analysis. And I'll point out where it says what the case mix data is through. If the admit date is on the program enrollment date, I've gotten this question a couple of times, the visit will be considered part of the pre-period. One thing we always like to highlight, nothing is controlled in this report. It's a one group pre-post design. The limitation is the ability to control outside events and not being able to compare results with maybe a similar population. Could always upload two different programs and try to do your own comparisons. But again, we just want to make sure people are aware of this. Also, one thing to keep in mind too is as time goes on, hospital utilization might go back to how it was pre, just because of regression towards the mean. That's another thing to highlight too. We don't factor in patient mortality because we don't have this data in the report. And one thing that we get a lot of questions on is patients without a hospital visit, but they're matched to your panel, they are still included in the denominator. They're on your panel, they're a patient on your panel. They just don't have any hospital utilization. So they would be included in your denominator still. So here are some new filters, or some filters. So previously, you might remember that the old pre-post report was 1 month, 3 month, 6 month, and a year, 9 months, and 12 months, I believe. Well, now you can select it in 1 month increments. So if your program's only running for like 4 months or something for a quarter, I guess that'd be 3 months, you're able to select 3 months pre-post if they're running. And you can look at hospital utilization 3 months pre and post that program enrollment date for your patient. So this filter just gives you more options for the pre-post time period. For visit type, you're able to select ED, inpatient, observation visits greater than 23 hours, and outpatient. One thing to note is ED only includes ED visits for patients that went to the hospital and left. And so patients that went to the ED and were admitted to inpatient will only be included in inpatient for visit type. And then we also have the most recent payer, and this is based on the HSCRC case mix data. And so it's whatever the patient used as their payer for their most recent visit. Some other filters that have been included, you may recognize the chronic conditions filter. This is filters to patients with a chronic condition based on the chronic condition warehouse's definition. So for example, a patient might be flagged with diabetes if they had 2 diabetes visits in the last 2 years. And so this patient would fall under having the chronic condition diabetes. More technical definitions are on the Chronic Condition Warehouse's website. So I recommend looking there if you have any, or if you want more details on that. We now included 2 primary diagnoses. And so primary diagnosis, we categorize the primary or diagnoses by the clinical using the clinical classification software refined categories. And so here you're able to filter to visits for specific primary diagnoses. And so if you're interested in certain visits on the primary reason why the patient went to the hospital, you're able to use this filter here. Here are some measures that are in the report too. Some of the graphs you can filter on different measures, or you can select different measures. So here we just want to include this just because we're not doing a live demo of the report to show you all the measures, but showing some screenshots. And so you have visits, patients, charges, and then we included average charges, charges per 1,000. You're able to see readmission visits, pre and post, PAL visits, which is potentially avoidable utilization visits, and potentially avoidable utilization charges. For more detailed information on what these definitions are, you'll be able to see them in the user guide. And so now I'm excited to actually show you the report. I've just been chatting about all the background, the filters, and everything. And so here is the report. And so, as I mentioned earlier, some of the boxes you want to keep an eye on are at the top here. And so at the top, right next to the pre-post time period, you'll see patients enrolled for the time period. This is the number of patients that qualifies for the selected pre-post time period you have here. We also have the case mix data through. Like I said, the most recent case mix data is through June 30th. So keeping this in mind when you're uploading program enrollment dates, because you need enough case mix data run out. We need enough hospital utilization data for that post period in order to be included in that analysis. And if you're using a panel, this just says how recent the panels we have uploaded are in this report. So keeping an eye on that if you're not seeing the new patients uploaded, or if you're uploading new patients you recently added on your panel to a program and they're not matching, it could be because we don't have this panel updated in our back end for this report. And so this report here, the program demographics tab here, we wanted to be able to give users a way to look at the demographics of their program. Before in the old pre-post report, you never were able to do this. So here you're able to see it by race, gender, payer, age group, county, and then you can also see the range of program enrollment dates. For race, gender, and payer, this is your most recent race, gender, payer selected in the HSCRC case mix data. So if your patient doesn't have any hospital utilization in the case mix data, we added this category called says not in case mix. And just so you understand that, yes, this person doesn't have any case mix data, so we don't have a race, gender, or payer. So like your distribution for these different demographics could be impacted if we did have that. Um, so that is the program's demographic slide or report. We also have our summary report. And again, I want to highlight at the top here, those boxes. Now there's an additional one and it says patients with case mix data for the time period, that second box. And so you have the patients enrolled for the time period. So how many patients that you uploaded. Not everyone's going to have hospital utilization visits, but the patients enrolled for the time period, they're going to be including the denominator. The numerator is based on hospital utilization, so they need to have case mix data in there. And so this top graph here just shows you broken down by visit type, different measures. So you can see total visits and the difference, patients, charges here. And as I mentioned, patients without a visit including the denominator. And then this line graph here at the bottom is here to show you how the number of visits you can select different measures for this graph to display here, but it selects a measure for each month. So at the bottom here, you'll see 3, 4, 5, and 6 months post, and then pre, obviously. So for example, 5 months post, that marker there will show you the number of visits that occur between 4 months post and 5 months post. And so here in this example, it looks like the number of visits are increasing. So is there something going on with your program that's causing patients to go back to the hospital after 3 months? Maybe that's when your program ended for some reason. Maybe they need additional help. It's just to give you an idea of um, how it's being impacted. And you're able to see all the measures and all the different visit types at the bottom here in that chart. We also added another tab for the diagnosis and service line. So here you're able to select a measure like I went through earlier, all the different measures you can select for these graphs. And so here this first graph has the primary diagnoses, and then the second is the service line. And so you can see the primary diagnoses for patients pre and post your program enrollment date. And maybe you see a trend that a lot of patients have a specific primary diagnosis pre versus a lot of might be a different primary diagnosis post. Trying to understand what's going on with your program, maybe getting a better idea. Service line just shows you just basically the reason for the visit, a high level overview or what the visit is for. And then at the bottom here, you're able to see trends in the bar chart by different demographics. So age is selected here in this category drop down. And so you can see based on different demographics if the pre and post were different. You can select the categories are age, I believe gender, you have payer, I think county, race, and you're able to see how the visits differed pre and post for your different demographics. This tab might look similar. It was basically in the old pre-post report, but this time we have more measures that you can select. And as I discussed the measures earlier in the webinar slides, those are the measures you're able to select. Here we have charges selected, but basically by hospital, you're able to see uh, where the selected measure pre and post. So maybe if you're looking at visits or even charges, patients maybe are going to a different hospital post for some reason, be like, hi, why is everyone going here now? This is just to give you, again, an idea to understand your population a little bit better. And based on user feedback while we were developing this report, users wanted to know, can I look at how many patients are included in the different time periods? Just so I can understand what time period maybe I want to use. Maybe I want to use a longer one. Maybe I want to use a shorter pre-post time period. And so basically here you're able to see the total patients included in your analysis for that time period. And then you're able to see it by patients visit. We incorporated length of stay because that was feedback we received. So it was length of stay before and after your program enrollment date, your charges, and then we included average charges too. And so you can see 1, 3, 6, 9, 12 months on the side there. That is just because in the old pre-post report, that's how it's broken down. So we wanted to be able for users to pull this easily here. We also included readmissions and PQIs. Readmissions is inpatient stay, and then a patient was admitted again into another inpatient stay in less than 30 days. It's based on the HSCRC's definition for readmissions for their readmission reduction incentive program. And then PQIs is prevention quality indicators. So basically, if you had sufficient ambulatory care, you might have not needed to go to the hospital. And this is based on their potentially avoidable utilization, HSCRC's potentially avoidable utilization policy. It's a component of it. So a lot of users ask for it because maybe they can look back at that or it's just a good metric. And then this chart on the bottom here is basically everything you see on this in the top chart. The bottom graphs just outline it though, like the number of patients pre versus post, visits, charges, and average charges to get an idea of how just to visually see the differences. We also have this new report too in here. I guess it's not as much of a report, but it just shows you. So when you upload a program, you're able to see now the first name, last name, date of birth, zip, gender, and the enrollment date of the patients you upload in your program, the patient ID, the MRN. And we put comments there. So um, basically, this one says enrollee not in case mix data. Basically, the patient will be included in the denominator, but they don't have any hospital utilization. And so you're like, okay, maybe like I like do like they should be included. You can just think about like how you want to go about this. And so you're able to see who is in your program a little bit easier and export out the details. So this was a very requested feature, and we were able to add it. And then also we have the visit details tab. This tab is actually basically the same as the old pre-post report. We didn't want to mess with it because users have their workflow already set up with it. I know a lot of users will use pre-post and just go to the visit details tab, and they have their own like Excel and charts they have created. And so here you can see the different breakdowns for the different columns in this report. And when you export it from Excel, you're able to, there's more columns you can see. There's more columns included than in what's in this Tableau report. So I recommend exporting out into Excel if you want to get more information on the visits. And so I have just talked for the last 40 minutes. I'm really excited for this report. We worked really hard on it. We've been wanting to release it for a really long time. And now it's here. If you have any questions, comments, feedback, please reach out to report.support@crisphelp.org. This is CRS's support email. If you need help, like I said, if you saw something in old pre-post and we didn't somehow incorporate into the new pre-post report, please reach out. If you have any questions, if you have any feedback, we can make this better. Anything at all, please reach out. And so the old pre-post report, we're going to be retiring in September just because with the new pre-post report, it can just be confusing to have two reports on there, and we want to push everyone to start using this new report, which is faster, hopefully easier to use, and it has more breakdowns. And any programs you've uploaded before into old pre-post, they will still be in there. They should still be in there with the redesign pre-post. You can go ahead and look and confirm, and if you don't see a program, reach out to us, but they should all be in there. So do not worry about losing your programs. And yeah, now I think we can take some questions.
Thanks, Grace. So I'm gonna read through some of the questions in the Q&A box, but please, if you have more, put them in there. I think we have about 20 minutes to answer some questions. So the first one we have, I don't know if this is what you meant to say, or maybe it was like a misspeak. Did you say ZPQIs at the beginning of the
Oh no, I'm at
presentation?
PQI, sorry.
Okay, no worries. So someone thought maybe that was like a new
No, there's no
PQI type or something.
PQI.
No worries. Meredith asked if we wanted to do a pre-post on a send panel that is on an auto sub with patients added in the background. Is there any way to access that send panel in CRISP somewhere to pull back the MRNs so that we can add dates for the pre-post panel?
That is a great question. I would recommend reaching out to your outreach representative. They will be able to help you with that, to help you identify the MRNs that are in that auto sub panel, and so you can upload a program into pre-post.
If you upload with multiple source codes and different MRNs from different source codes and they match to the same patient, will they get flagged as duplicates?
I believe I need to actually follow up on this one. That is a great question. I believe it should be flagged as a duplicate because it will go back to the same unique identifier for the patient. And so that is one thing to keep in mind, making sure if you have separate, if you're uploading with multiple sources to make sure a patient isn't repeated. But we can confirm with you, Lucas, and make sure we get you the right answer.
For ED visits, is what you're describing a change in how you count them? or have they always been counted as either ED, i.e., visit or and left, or inpatient ED to admit?
They've always been counted like that. And the reason is because you don't want to double count ED visits that were admitted into inpatient under ED because they are included in the inpatient count. This is how CRS has always done it in the past. So this is not a new methodology, and all our reports should be following the same methodology.
Martin is asking for one of the old features to stay. So one of the metrics included in the old version that we used the most was change in average charge per patient, but it's not in the redesign report. I understand it's in your backlog to add to the future, and we can manually calculate it, but it does take a lot of work for all the time periods in service for each service type. Can we have this enhancements prioritized? Can the old version remain available until this metric is added to the revised version?
Yeah, and thank you for reaching out about this. We have it in our backlog. And we will definitely prioritize this enhancement because we know it is can be difficult or just frustrating to calculate when we can easily do it in this report and we had it previously. So thank you for pointing that out. And we will be in touch when we're getting ready to add it and maybe get some feedback on where to add it, where it would be most helpful too. So thank you for bringing this to my attention.
And then someone asks, is my pre-AH report access the same as well?
I believe pre-AH is related to MDPCP and the multi-payer reporting suite. I would recommend reaching out to report-support@crisphealth.org, and they will be able to check your access.
Yeah. But I don't think this change would affect any of that reporting
Um,
suite. But so someone has a suggestion. One small improvement I could suggest is to have the programs unselected by default so that we don't have to click through several of them to narrow down to one.
Yeah, that is a great suggestion. We will definitely add it to our backlog, and consider it. And we can always reach out to if when we plan to add it, or if there's been some pushback to not add it, and just get some, what would be best for users.
And Martin says the new format looks great and he's appreciative of it.
I'm glad. It took a lot of work, but we're really excited to have it released.
And that's the questions that we have so far. Maybe we give another minute or two to see if anyone else has anything else.
Sounds good.
Um, but just as a reminder, we'll send out the recording and everything. And yeah, please use that reports support email if you have anything additional that you think of later. So we'll just give it a minute or two. Alrighty. Well, seeing no other questions, I think we can conclude this presentation. Thanks so much, Grace, for giving us a full overview of what has changed in the new report. And thank you all for joining. Hopefully, you can start using this report. And please let us know if you have any feedback.
Thank you
Thanks.
all.
Take care.